Hi, I'm Andrew, an entrepreneur and a computer science student,
Hi, I'm Verene, a psychology major student.
and you're now listening to the Ink Thoughts podcast, where we ponder and talk about incongruous thoughts ranging from our daily life to the human mind.
Hello everyone, welcome back to another episode of Ink Thoughts podcast. Yeah, it's me again. Yeah, I think a few episodes um, ago, the past few episodes I've been mentioning a bit about me started working, and yes, today we are going to finally talk about it. Yeah. So it's been more than a month since I started working, and yes, I've now completed my master. And if you haven't listened to the last episode where I talk about my graduation, yeah, feel free to listen into it later. And fortunately, I have secured myself a job to continue staying in the UK, which is a very happy thing. Yay! Yeah. And to be honest, I'll say I'm actually very lucky as and I didn't need to worry too much about job searching after I completed my study and graduated, because I applied for this for this job a few months ago, thinking that I probably could do some part-time jobs in mental health industry, as I'll be only working on my research project during the summer semester. I'm fortunate enough to be offered the job, and they told me that I could become a full-time after I graduate, which is a very good thing. Yeah, you kind of secured the job way before you graduated. Yeah. Although there were unexpected stuffs happening in between that I ended up didn't manage to do any part-time during summer, but things still went well, and now I'm working with the NHS. Yeah. So what's my job about? So I'm actually working as a healthcare assistant in a psychiatric hospital for child and adolescent at the moment. So it is an inpatient service. I was quite excited for work before I started working because things are relatively new to me. I've never been to a psychiatric hospital, and don't even mention about the service that is specifically only for child and adolescent for mental health. I don't know what to expect before going to work. And so on my first day, it was quite an eye opening experience for me. It is actually a very friendly environment in the ward, and the only thing that is quite restrictive would probably be the young people normally wouldn't be allowed to leave the ward without staff facilitation or escorts. There were different activities planned for them to carry out and to keep them occupied, which could be quite therapeutic as well. And me as healthcare assistant, I could join them doing so as well. I'll say so far I get along with the young people well, and I guess that is helpful in terms of allowing me to support them better during times that were more difficult for them and they needed support more. I'm so glad that I was able to do this. Like before I started working, and at the first few days of my work, I was actually quite worried about it because, I don't share the same background and with them, and a lot of probably like childhood stuff I have no idea at all because yeah, they are still young, they're teenagers, and um, the stuff that they watch or they listen to or they get engaged with while growing up, I have no idea what they are at all. Yeah. But still, things went well. And yeah, although there were times that I don't really know what they're talking about and I can't share the same ideas with them, but still, um, there's a lot of other stuff that we could talk about. Yeah. And colleagues are friendly and helpful too. This is a role that requires a lot of teamwork, and I could really see teamwork over here. And they always try to make sure each other are okay during very stressful time. It gives me a sense that if I'll be comfortable voicing out my needs when I need, which is quite reassured because you know that you're not alone in this and you'll be able to seek support when you need. Managers are very approachable and friendly too. I'll say so far, my first UK work experience has been really great. So, reflecting on my working experience and comparing it with my previous working experience in Malaysia, I'll say it's a very different one. First thing first, it was not quite comparable because the work that I did in Malaysia was an outpatient service, and hence we don't spend as much time with the patients as compared to an inpatient service. However, those skills and knowledge that I've learned about mental health from my working experience and my master have definitely helped me getting along better with my current role. Building rapport with the young people wasn't a thing that come immediately to me, as I mentioned earlier. I'm not as extroverted and I sometimes struggled with coming up with things to talk to them. However, I've been able to push myself in doing so, even if it's difficult for me, which I'm happy that I did. I have to say, my working experience in Malaysia has allowed me to practice this too. It is totally understandable that people wouldn't want to open up to you if they don't really know you and they don't feel comfortable with you yet, as they couldn't trust you in voicing out their vulnerable parts. This is totally understandable. And so I'm still working on this too and try to get better in building rapport with different patients. And another thing that amazed me from work is that there are such services in the UK for young people. I think in Malaysia, we are slowly getting more understanding about mental health now, but still the strong stigma is still there. And because there's even lesser understanding about mental health in child and adolescent. From what I know, I don't think there's an easily accessible service in Malaysia that is specifically for child and adolescents' mental health. I know there are more and more autism centers opening up in Malaysia, but so far it seems like the services available in Malaysia are only accommodating young people with autism, ADHD, and learning disability. Unfortunately, young people do get affected with mental health problems, and a lot of the time they were dismissed because there's only limited understanding about it. I'll say not only young people, but in general, we we probably should develop more understanding about mental health so that it helps helps everyone in general. So I guess that's my thoughts and reflection about work in healthcare industry, specifically mental health care so far. I've been enjoying my job a lot after a month in, although it could be quite tiring sometimes because it's a shift-based role and we work long hours as well. So it could be quite tiring sometimes, especially when the ward is busy, but still it's an enjoyable and fulfilling role itself. I'm really happy that I'm able to do things that I enjoyed. And I hope you guys are doing things that you like too. If you're not doing things that you like at the moment, it's fine. You slowly find them, and I believe you'll be able to do it one day too. Just believe in yourself, and keep going. So I guess that's it from me today. We'll see if there's anything that I'd like to add on about my job experiences and things that I'm able to look at in the future. So I guess that's it from me today. Thank you very much for listening, and I hope you enjoyed this episode. If you do have any kind of different thoughts that you'd like to share with me, feel free to comment down below, and I'll get in touch with you. And I guess that's it from me today. I'll see you guys next time. Goodbye.
Thank you for listening to this episode of the podcast. If you enjoyed, do share with your friends and family and leave us a review on the Apple Podcast. If you're not using an Apple device, you can leave a review on the Apple Podcast website with a link in the show notes. If you have any feedback or thoughts which you hope that we'll discuss in the future, feel free to email them to us at hello@incthoughts.com, or alternatively, you can send us a private message on our Facebook, Instagram, or Twitter with the username of incthoughtspod. Thanks again, and see you all next week. Bye bye.